Hi there everybody, and welcome to Radfield Home Care's Coronavirus Focus. In today's episode, we're going to be discussing a topic that a lot of people have asked a lot of questions about, and it's been quite topical within the media as well, and that topic is PPE. Now, in the care sector, we've had to make a lot of changes to incorporate PPE into our daily operations to keep our staff and our workforce safe. Today I'm joined by Hannah MacKechnie, our founder and franchisor, who's going to discuss some of the changes we've made in our model in order to make those changes. Hannah, welcome.
Thank you.
No problem at all. So Hannah, are you able to take us through the journey, I suppose, of PPE, both before the pandemic began, through the peak of the pandemic, and where we're at today with the use of PPE, and I suppose the cost implications of that as well?
Yeah, sure. I suppose pre-COVID, we were using PPE day to day in our home care service. So our carers very much, it's part of their training, it's part of what they're used to wearing. However, it wasn't the full range of PPE that people are seeing now. So obviously now we've had to add to that range of PPE. So now it's face masks, it's visors as well. So we've had to sort of broaden the range of PPE that we're supplying. In terms of going back to sort of December, January time, part of the role of Radfield as a franchisor is to make sure that we're assessing, for risks and opportunities. Yeah. So we're keeping a very close eye on the coronavirus pandemic as it was starting. Yeah. So we were able to identify that and make sure that our network were ahead of the curve really in terms of stocking up on essential PPE items before the cost started to go up. So in February, March, we started to see the supply shortage creeping in, and then obviously with that, the cost starting to escalate significantly. So we were able to make sure that our network were well stocked up in advance. Yeah. However, obviously costs have gone up, so we have had to pay more for PPE as everyone in the sector has had to. But with that, I would say there's been quite a lot of funding available as well. So local government has been able to support some of our areas across the country with PPE costs, which has really helped as well. Okay.
Brilliant. So what about availability now, today? How is that looking in terms of, is it a bit easier to get hold of PPE now, and are those costs starting to come down, or are they still sitting quite high?
Yeah, the costs are still sitting quite high, but we are seeing signs of that they're coming down a little bit. But also availability has definitely eased quite significantly over the last sort of 4 to 6 weeks. I would say it's been quite noticeable. But also we're making sure that our supply chains are open and are able to, every one of our franchise offices is able to get supplies. Yep. And that again, that's part of our role to make sure that we're able to ensure that they're able to operate safely throughout these times. Yeah,
absolutely. So are you able to expand a little bit more about how we supported franchise partners with sourcing that PPE? Were they going to local providers, or do we have a national provider perhaps that we've been using?
We've had recommended suppliers that we use for our network, so we've obviously kept those relationships going and making sure that they're able to supply. Where those supplies have become quite short at the peak of the pandemic, we've been able to look at other national suppliers and also government preferred suppliers as well, who've been able to supply to the NHS and then also to social care as well. So we've been able to make sure that we're keeping abreast of all of the suppliers out there to ensure that our franchise partners have got routes to that essential PPE.
Okay. And correct me if I'm wrong, I believe there's been a bit of positive news on the VAT front as well in terms of PPE over recent weeks. Are you able to expand on that a little bit?
Absolutely. I mean, it's been great. We've actually been part of a campaign to try to address the VAT in the home care sector. So as part of that, we were lobbying government to actually look at the VAT rates. And what they've actually done as a response is to stop the VAT applicable on PPE during the course of the pandemic. And that's actually also continuing for a few more months as well. So although it is just a short-term change to the VAT status for the PPE equipment, it has had quite a nice sort of cost benefit to our franchise network, who've obviously had to be purchasing additional PPE throughout this time. So so that's been really positive to actually be able to support that campaign and lobby government and actually see some real change as a result.
Okay. Brilliant. So the upshot of PPE then ultimately has been that it's really, yes, it's been a bit of a challenge to get hold of at times. It has added a bit of an expense to business, but ultimately it's meant that we can keep our clients safe, we can keep our carers safe, and fundamentally we can continue to provide services and, as we've discussed previously, continue to grow. Where if we didn't have that PPE in place, then we wouldn't really be able to do that.
Yeah, absolutely. The PPE is a requirement. It's essential in order that we can keep our workforce safe and also our clients safe. So yes, it is absolutely required. But yes, we've got, proper supply routes, and as I said before, the cost, we are starting to see signs of it coming down as well, which is really great to see.
Okay, brilliant. So hopefully that's given you a bit more insight into PPE and the impact it has had on the care sector. As I mentioned, it's been a question I've been asked quite a lot in recent weeks when I've been speaking to various individuals, and it's been a hot topic in the media as well. So join us next week for our next episode of Coronavirus Focus, where we'll be looking at some of the questions that you have been sending us over recent weeks and diving into those in a bit more detail. If you do have any more questions you would like us to talk about, you can email them across to franchise@radfieldhomecare.co.uk. We'll see you then. Thank you.